Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no copay. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hello, everyone. Can you believe it? We're in January of 2025. We survived 2024. We made it, and now we have our work to do to get back, those New Year's resolutions, take off those few pounds we may have gained during the holidays, having Aunt Betty's cookies or whatever. So I'm really excited about this year. We have a lot of great podcasts coming up, and specifically want to thank my sponsors that have brought these stories to you, from the very beginning, from our fragile beginnings here with no listeners, and we've grown and things have been so great. And so Keto Mojo, great company, they helped us get us through that first year. They agreed to that first year of sponsorship, and that was fantastic. And so they're still my go-to for Keto Mojo for ketones and sugars, and greatly love the company and the owners. They're fantastic people, so continue to support them. But this year we're focusing more on Health Code Get Health. Fantastic company started by Ben Bickman. Their protein formulas were designed by him, and his brother Joel Bickman has taken over the company, and he's doing some great stuff. Great people, just really, really good. I'm so honored to be associated with them. So the big things we're talking about this year is berberine. They have a special berberine that I like. Berberine helps with insulin sensitivity. We're using it in our pre-diabetics and diabetics, those of us who have metabolic dysfunction, which is about 93% of us or so, especially after the holidays, probably 98% of us maybe at this point. But their berberine is very special. It has turmeric and broccoli seed extract, which is what I'm using right now, and I love it. It's supposed to work as an anti-inflammatory and help get that body a little bit more sensitive to sugars and insulin. So that will help us on our journey. Also, they have great protein shakes that our own Chris Cornell has been using, and he's transformed. He's actually doing some commercials for them this year, which is pretty cool. He's really changed his life. You can go back and listen to that episode. He's a fantastic guy, and he's been a huge supporter of the podcast. And also, they have the fermented pea protein that they're using now for people who are more on the vegan side or vegetarian side. And then they have the old faithful, the chocolate macadamia and vanilla. Great shakes. That's what I use after my workouts. If I go on a long ride, that's my recovery drink. So everyone, please support them. We greatly appreciate them. That we have discount codes on our website. If you go to ArizonaMetabolichealth.com, we have connections, discount codes, all that kind of stuff. And if you haven't signed up for our newsletter, please do that, and you'll be apprised of everything going on and be on the Insiders Club here. And for our Patreon supporters, thank you for getting us off the ground, helping us to get going, and paying the editors and the video guys and all that kind of stuff. Greatly appreciate your support. It's less than 1% of listeners, so I'm hoping that a few more people say this year they want to help out and get some more stories coming out here. But hey, happy 2025. Let's attack this together. And again, thank you, Health Code Get Health, GETHLTH.com. Both of my parents are on it. I'm using it with my senior patients and really helping to build some muscle mass and get some good nutrition, and we're seeing amazing results. So thank you all, and enjoy this episode.
Discover a new path to wellness at Arizona Metabolic Health. Dr. Brian Lenzkes offers advanced medicine and personalized care, treating the root causes of your health concerns, not just the symptoms. Whether you're seeking direct primary care, effective diabetes management, or medical weight loss, with a holistic approach, our team is here to guide you every step of the way. Visit ArizonaMetabolichealth.com today to learn more about our innovative health solutions.
Hello and welcome back to the Life's Best Medicine podcast. Today, I think a lot of you know I haven't been a huge fan of the traditional medical system. That's why I jumped ship in 2020, right when COVID was starting, not knowing what was coming. But it was the best decision I've ever made besides marrying my wife. That was definitely number one, but this was number two. So the problem is, how do doctors get out of the system? How do patients get out of the system when you're frustrated? I just gave a talk on healthcare reform, and one person out of the crowd said that they like their doctor. One person. I was like, oh my gosh, this is crazy, because they go in there and the doctor's saying you're doing it wrong. You shouldn't be eating low carb. Carnivore is going to kill you. And so it's a hard thing. A lot of people have traditional insurance on the side. In San Diego, I think 60% of my people are a member of a huge HMO that people will know who I'm referring to. But they come to me for metabolic health because they said they're not helping me. They said you could either go on a liquid diet, you could get bypass surgery, gastric bypass surgery, or be vegan. That's their choices. And they said, I don't want to do any of those things. So, uh, Andy Schooner, thank you so much for joining me. You're from CrowdHealth, and so tell us how you're going to save us from the system.
Yeah. Oh, that's good opening question. I love that. I'm one of your folks too. I wonder if you would have asked that question a little bit differently and said, who likes their health insurance company? I would be shocked if anybody raised their hand. And if I was in that audience, I sure wouldn't. This is my second healthcare company. My first healthcare company was a remote patient monitoring company. So we were monitoring blood pressure, blood sugars, weight, things like that from folks with chronic conditions. So, I sold that company a few years back and moved to Austin, Texas, where I thought I was going to eat tacos and play golf and go fishing, which are my favorite things in life. And little did I know that God had a different path for me. My little one, who was one at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who told us that she had a perforated eardrum. So she needed tubes in her ears, pretty benign thing. Lots of folks have these. It's just one of those things when you're a kid. So we went to the local hospital, got tubes in her ears. It was a 15-minute procedure, and got the bill, and it was $8,000 for 15 minutes. I was just like, holy crap, $8,000 for 15 minutes, but this is what health insurance is for. Like, this is the point of health insurance. And so little did I know, about a month later, I was going to get another note in the mail from my insurance company, where they said it was medically unnecessary. And so they weren't going to pay for the bill. I was like, hold on a second. She had a hole in her eardrum. Like, how is this not medically necessary? We went through 3 rounds of back and forth. I think my ear, nose, and throat doctor was, arguing with I think it was an ophthalmologist or something internally at the health plan around my daughter's ears. And at the end of the day, they refused to pay for it. So I had to stroke an $8,000 check to the local hospital. And as you can imagine, I was pissed. And it was at that moment where I'm saying, you know what? I'm done with this. I'm done with health insurance. I'm not doing it anymore. I quit, and I became uninsured. I think that was in 2019, if I'm remember correctly. And I have been uninsured since, and I have built a company to help people viably pay large and small medical bills, without the need for health insurance. And so, that's the company that I founded back in 2021, called CrowdHealth.
Yeah, and I'll just tell you from my personal experience. Just 2 weeks ago, my daughter, who's a preschool teacher, doesn't make a ton of money, has her health insurance through her company. She went to the ER for abdominal pain. She was there for 3 hours, $11,000 bill. Her copay was $4,000, right? You have this young in her early 20s, like, now you get a $4,000 bill. It's like, I thought I had insurance for this. Like, am I not supposed to get sick? And
Yeah.
maybe you could speak to that a little bit. With the Affordable Care Act, as a doc, I was looking at, and a lot of the hospitals or surgeons in the area wouldn't take it at all, because they said, look, we at that time, I don't know how it is now, but at that time they couldn't confirm eligibility. So someone would pay like 2 or 3 times because they don't have money, and then they stop paying it, and then it shows up that they have this insurance, and then they go get a knee replacement, and the surgeons found out,
Mm-hmm.
like, one of the surgeons I work with, 4 patients had no coverage. So either you're gonna have to go after these people to get paid, you have to pay the hospital. I mean, it was they said, we're just not doing it anymore.
Sure. Yeah. The Affordable Care Act plan is the plan that I had, that denied my my bill, my claim. And as I look deeper into that, what I found is 17 to 18% of bills are denied by Affordable Care Act plans. So, that's one out of say five or one out of six. I live in Texas. Blue Cross Blue Shield of Texas in 2022 had 20 million claims. They denied 4 million of them. So that's one out of every five. That doesn't sound like good insurance to me. If I have a one out of five chance that my insurance company is not going to pay it, and I checked this year for Affordable Care Act just to see what me and my family would be. Had no intention of getting it. I was just checking, but it was going to be $1,400 a month for me, my wife, and my two girls, and I believe it was a $16,000 or $18,000 deductible. And so, if you have 75% of Americans having less than $5,000 in their bank account, how can they pay for an $18,000 deductible? And so what I do is I tell people, I say, look, if you don't have enough money in the bank to pay for your deductible, you're paying for health insurance that you can't actually use because you are on the hook for that first 18. And as you said, your daughter's a preschool teacher, probably, I could be wrong, $4,000, not an easy thing for a preschool teacher to come up with. And so in essence, what this is doing is it's putting people into bankruptcy. There's 200,000 families in 2022 that went bankrupt due to a medical expense, even though they had health insurance. So these are people that had health insurance. They're still going bankrupt because of a medical expense. That's the challenge with our system. And, that's what I want to blow up. Because I think it's immoral and evil in many, many ways.
It's a huge issue. I mean, in my old practice, I had a lot of patients who happen to be well off, and they go, "I'll just self-insure." So for them, they say if something costs me $100,000, I just pay it. No biggie. I have it in the bank, right? Like, and all self-insured. And they go, over the years, they've saved so much money doing that. But they had a major medical situation, right? If they could have a $20,000 deductible, they're like, no big deal. Not very many of us are in that situation. We could just sell, but those guys, that the Affordable Care Act made it so they couldn't do that anymore. So now they're paying into the system. And now they're not happy because they're bound by the rules of the system too, and that's not very good. And for me,
amen.
From a doctor's perspective, I remember I'm looking at my reimbursements, going, "Wait a minute, this is crazy." My insurance, my reimbursements as a physician was going down and down and down, and my cost for insuring my family was going up and up. That's when I jumped out of the system, probably 2017 or so, and went with a different type of a Christian-based crowdfunding source, right? But I started realizing. So one of my partners, his wife called the insurance company, said, "Why is it that our rates keep going up?" They said, "Well, because the doctors were paying the doctors more to take care of you." And they're like, "No, it's not, because my husband just got a pay cut from you guys. It's not true." Right?
No.
The money's going somewhere else.
Yeah. Only 8% of our funds are going to pay doctors. So 8 cents of every dollar that you pay into the system is going to pay medical doctors. Like, that's how screwed up our system is.
Well, and another thing on top of that, I'll tell you like that, is that you're right. And I realized that I'm like, wait, we're a small part of the primary care is like 0% of the budget pretty much, right? So when you start looking at it from that perspective, you have a primary care who's interested in preventive medicine. Now you could save the system a ton of money. But right now they go, okay, how was I paid? My bonus, did all these patients that have diabetes get a statin drug? Do they get another drug? Do they get this drug? Not did you reverse their diabetes or did you keep them from going on dialysis? There's no payments for that. But there were payments for doctors for certain interventions. They got bonuses if you got everyone to get this one intervention in particular. So there's a lot of conflict of interest.
Are you going to get demonetized if you say it? Say what the intervention is?
I've been taken down 4 times. We might as well go for 5. What the heck, man? So yeah, like the doctors knew darn well. And I think that's we could just talk about it, a conflict of interest, in that if I get paid for everything, if I tell you have to take this certain medication or a vaccine, and you don't take it, I get docked. And so what they did is which helped me out, because they fired their patients, because they would meet that if you didn't get to 80%, you didn't get your $250 that year per patient, right? So there's a conflict of interest, and that should have been, they should have told their patient, hey, look, if I get a certain percentage, I get this, right? And I've told people that with colonoscopies, for instance, if you don't get enough percentage of your patients a colonoscopy, you get docked on your bonus at the end of the year. So there's all that kind of stuff. But the intention was, we want to provides state-of-the-art healthcare, but the problem is they're basing it on some really bad information.
Yeah, yeah. Well, I mean, I think you bring up good points here, and what I say too is, if you have health insurance, ultimately your doctor is getting paid by the insurance company. Your doctor may work for a hospital system, but the hospital system gets paid by the insurance company, and so your doctor, in essence, works for the insurance company. You work for whoever pays you. The insurance company is paying for you. Is and so I think it really screws up that doctor patient relationship where in our model we enable the members to pay the doctors directly in cash themselves, which changes the dynamic totally. Now you doctor I'm your customer, not the health insurance plan. You answer to me, and not the health insurance plan, which I think is really, really valuable. And in fact, I had a little chest pain last year. It ended up being a nothing burger, but I went into the cardiologist and I said, "Hey, I'm cash pay." He's like, "Man, that's amazing. You got to go get a stress echo test, but if you were insurance, I'd have you come back in so I can give you the results. But since you're cash pay, can I just call you on the telephone and I won't charge you anything?" And I'm like, yeah, like why would I want to spend an hour sitting in a waiting room and all that kind of stuff when you can just call me? And so the care changes, the customer relationship changes. And so I think that's really, really important that we need to get back to paying our doctors directly from our own pockets whenever possible, and that changes that dynamic.
Yeah, and
So
Andy, that was one of the problems with the Affordable Care Act, because I saw these poor guys struggling, and young kids would come in and they have the Affordable Care Act, and then like an office visit would be say just for the heck of it, say it was $300, right?
yeah,
Well, if I see someone that was on a Blue Cross PPO or one of those plans, I would get paid like $80 or whatever. I mean, like the reality. But these poor people with the high deductible, they were charging the same rate they charge the insurance company, and I was like, that's unethical. I think it would help people a lot. Let's just do a cash pay pricing. But when
yeah.
you're in the system, there's a lot of legalities of that too. I got in trouble one time because the HMO called me and goes, "Look, you saw this patient, you didn't charge a copay." I go, "He's the head trauma surgeon at the hospital that I work at. I'm not going to charge him a $40 copay." Like, he's a friend of mine, right? But they go, "No, that's enticement. You can't do that." So there's all this
Yeah.
weird stuff that you get into and you go, "This is weird." Like, you can't just, because a lot of people, I would just write it off. If I knew they were struggling, I would just write off the visit. No big deal, right? Because Blue Cross was going to pay me $8 for that visit anyways. I don't really need the $8 that bad to, because the patient was going to pay a heck of a lot more than that. So that's what we're
Yeah.
realizing, in the system, the blatant problems that are there. Like you're saying, if you have a $16,000 deductible or a $15,000 deductible, you have no money in the bank. It might as well be $1 million.
Yeah. I mean, the insurance is useless to you if you have that high of a deductible and you don't have enough money in the bank. It's useless in essence. So yeah, I mean, I saw a stat the other day that I thought was interesting, and it was a survey of doctors, and I think they surveyed 5,000 doctors or something like that, and what they found is that 15.5 hours of a doctor's week is spent fighting with health insurance companies on pre-authorizations or getting paid or some administrative task related to getting paid. And so people ask me why, you can get so much better rates when paying in cash. And I'm like, think about this. The doctor doesn't have to haggle with a health insurance company to get paid. You're handing them a credit card at the point of care and they're paying 2% as opposed to having to spend almost 2 of their days a week fighting with these health insurance companies. And that in essence makes our business model work because doctors are willing to say, yeah, I'll take a little less because the hassle of this is way less than having to go out and bill health insurance. Not only that, you have billers in your office, you're paying billing fees, you got all these people that you have to take care of to actually get paid. Versus with me, I come in with my visa and say, here it is. That's a way better situation, both for me because I'm getting better prices. It's better for you because you don't have to deal with all the health insurance BS, and it makes for a better system because it's now between the doctor and the patient to determine what kind of care I can get. I mean, that just feels like a win-win-win all around.
Yeah, and that's when I jumped, took my family off the system. I had a similar experience as you. My youngest blew her knee out playing soccer, so we're waiting in the waiting room for the MRI, right? And the lady's like, "Your copay is $600." I'm like, $600 copay? like it's $1,400 for the MRI. I go, like, how do people? I said, like, what about people who have no insurance? What are they doing? Like, they're paying $1,400. She said, oh, hold on. She comes back. Oh no, the cash pay price is $300. I'm like, what? So I go, if I pay cash right now, it's three. Here's my Amex. You use Visa, I use
Yeah.
Amex, right? Here's the Amex. Like, put it on there. $300. I'll take it any day of the week, right? So
Isn't that
things like that, and
ridiculous?
you don't realize how crazy this is. And like an X-ray is $26 or something crazy like that. I mean, it's so cheap to pay cash because we all think, oh, I need insurance because that MRI. If I need an MRI, how many MRIs do you get in your lifetime? Right? Unless you have cancer and you have other things. So from
Sure.
a from a crowd health, how is it that you can provide this kind of, like, the big questions I would have to you are, number one, how can you provide this kind of service to the general a general business owner, for instance?
Yeah, real quick on that previous point. I think people might be asking because you made a really good point on the cash pay price being much less than the insurance. Um, the question always comes up: how can you, as an individual paying in cash, get a better price than United Healthcare, which is the seventh or eighth largest company by revenue on the planet? Like, aren't they supposed to be like fighting for us, like to get us really, really good prices? And what people don't fully understand, and when I get asked like why is healthcare expenses, why are they so high? My response is pretty simple. You don't need to be an economist to understand this. One is the buyer of healthcare, health insurance companies, actually have an incentive to see your prices go up over time. So health insurance companies make more money if prices go higher because what it happens is called a medical loss ratio. They can only make 15 or 20%, depending upon the type of plan, of your premium as profit or administrative costs. So if you have $1,000 premium, they can only make 150 bucks, 50%. 15%, excuse me. So how do they make, $165? Well, your premium has to go from $1,000 to $1,100. So they actually have a incentive to see your premiums go up over time. So the buyer of healthcare wants the price to go up, and the sellers of healthcare, which is these big hospital systems, of course they want to see the price go up. And so when you have the buyer of a product and the seller of a product both wanting the product price to go up, guess what? The price goes up. Like, it doesn't, like I said, it doesn't take, a Nobel laureate to figure out that, this is why our system is so screwed up. There is no other force in that equation that pushes prices down. And so that's why we at Crowd Health, and you and what you're doing is saying, no, 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 no. Like, the person receiving the care has to have a little bit of skin in the game. So they are the driving force to push these prices down, or else the prices will keep, inflating over time. And we've seen that for the last, 40 years of prices going up because there is no other side of the Adam Smith's invisible hand to push, prices down. And so that's why prices are going up, and that's why United Healthcare, Blue Cross Blue Shield, whoever it may be, don't particularly want prices to go down over the long term. Yes, in the short term, they want prices to go down. Like I said, they can only make 15%. So if their premiums start, or their medical costs start increasing beyond that 85%, 86, 87, they'll start rejecting claims to get down to that 85% to maximize their profit. So the health insurance company's incentive is to maximize profit. I don't have any problem with that. It's just that they're doing it by rejecting claims in the short term and then letting prices increase over the long term because that's maximizes their profit. That's what's screwed up with our system right now. And again, it doesn't it you don't need an MBA to understand this. Like, it's a pretty simple, supply demand, or lack of
Well,
supply demand, I guess, because there was really no market forces going on here.
well, not only that, when I resigned from my my job where I was a good percentage was this HMO, and they have a senior HMO, right? The problem was I sat down who I trained with, one of the head guys in this in the insurance, the HMO insurance, and he goes, Brian, why are you leaving? Like, I know how much money you made last year, and my listeners will hear me tell this story because it was mind blowing for me. And I said, look, since I've been doing low carb with people and keto and carnivore type stuff, look how many people I've reversed. Like, we had 11 people in 6 months reverse their diabetes, like come off insulin.
Amazing.
And then we had I go, look, I have 64 other people I can show you would have got diabetes, but we intervened early. We got a fasting insulin. We intervened and we changed the curve and we pushed them away from diabetes, getting that diagnosis. And I said, do you know how much money, the number one thing you're spending money on in the hospital, bypass surgery, wounds that don't heal and amputations, dialysis, blindness, all these things that are all diabetes related. I'm preventing all this stuff. I get zero bonus, and I've spent hours and hours with that patient through my lunch hour, and I took away time from my family. I would put people at the end of the day and at lunchtime so I could sit there for an hour and explain what they needed to know to prevent this from happening. He said, Brian, you're costing us money. I said, how am I costing you money by preventing disease? He said, because if they get that diagnosis, then we get paid more by the federal government. That's like the federal government looks at it, the sicker the patient is, the more we're going to pay you. It's like, that's a conflict of interest, right? How aren't I supposed to make you healthy and never have to come in to see me? That's why I went to direct
Yeah.
primary care and go, look, I'm betting I can invest an hour in you, right? And then I don't have to see you as often because you're going to be healthier. If this is what you want to do, if you're just going to eat your donuts and cake and do your thing and not exercise and be stressed out all the time, guess what? You're going to be using a lot of resources. I'd rather not use those resources. Yeah, right. Just because I have AAA doesn't mean I'm going to run my car into the ground so they have to tow me everywhere.
Yeah, that's crazy, man. I got another quick story for you because the previous company that I ran, as I mentioned, did remote patient monitoring, and so we actually did like a diabetes program. This was in 2008, I think. It was one of the first. Well, this is so far back that we had dial-up video modems. So, I could see video, but it was dial-up. So for us that remember AOL, it's like,
oh yeah,
like,
yeah, that sound, yeah.
It would do that to connect, and you could actually see the person on this video phone, but it was through dial-up. So you can imagine how good this was. So we had a health plan in Texas, and 100 members with diabetes in the Rio Grande Valley. For people who know Texas, this is a highly Hispanic. The population was 50% or something like that has diabetes. And so we did these video visits and we said, hey, listen, like you got to cut out your tortillas. And they said, no, look, I've been having 3 tortillas with every meal since I was like a kid. Like, I'm not doing this. And we said, okay, well, have 3 tortillas with every meal this week and then take down your blood sugars. We are actually remotely monitoring. So they just plugged in their glucometer to our little device and it sucked out the data immediately. And then do 2 tortillas and then do 1 tortilla. And then over a period of time, what they saw is their blood sugars actually went down based upon the number of tortillas that they were having with their meals. And they didn't kind of understand like blood sugar, tortillas, like how does that change blood sugar? Just didn't understand that scenario. And so these members had 10, 11, 12 A1Cs. I mean, they were bad, diabetes, right? And we were dropping them down to like 6, which is still pre-diabetic, but significantly lower.
You kidding me? The complication rate is dramatically different between 6 and 14.
Lower.
Are you kidding me?
And so I'm like so excited. I'm walking into the chief medical officer's office. Like I'm fired up. I'm like, we got the data. Look at all these diabetics that we've been able to drop their A1Cs. And he looks at me. He's like, we're shutting down the program. And I'm looking at him. I was like, what? Like you're shutting down the program? Look you don't have to pay for insulin. You don't have to pay for all the side effects of diabetes. Nobody's legs are getting amputated. Like, what are you talking about? And he kind of walked. It was the first time I kind of walked through, and this was the very beginning of the MLR conversation. And so this was like a year later. So it was 2010, 2011, maybe. And he's like, look, if I have $100 million of premiums coming in, I have to spend $15 million on administrative and $85 million on medical costs. If you drop that 85 million down to just say 80 million or 80 or 75 million, like I then have to drop my administrative costs down. And you know what that means? Like I have to fire people, I have to reduce salaries, I have to, all these things. And I'm like, oh my God. Like
yeah, by helping people.
We're so screwed. Like we are so screwed. Like because the health insurance plans actually have us getting sicker. Like that's their incentive. They make more money or else they have to cut people because they have to drop down their administrative costs. Like it's absolutely absurd the way that our system works. And so, all this to say, man, and you asked the question and I'm sorry, I kind of backtracked into something else, but our system is so screwed up. I left my situation with my daughter. I was like, somebody's got to do something different. Somebody's got to do something different. And if we can get a group of people together, and so far we've had about 10,000 people sign up for CrowdHealth, who are willing to say, hey, you know what? If somebody in my community gets hurt, I'm willing to help them out. So instead of going to the health insurance plan who has incentives that are contrary to my best interest, Like I'm willing to help somebody else out in my community who has a big medical event. So let's just say you break your arm and it's $5,000. I'm going to go out. CrowdHealth is going to find 50 people in that community that are willing to give you $100 each. And so we ask 50 people, and if they say yes, then $100 goes. They submit $100 into your account at CrowdHealth, and at the end of the day, you have $5,000 now to go pay in cash your doctor for that broken arm. And as a result of paying in cash, you're getting much better rates than United Healthcare. We're getting for the bigger bills, 50% better rates than United Healthcare for our members because they're paying in cash. And so we've done this 20,000 times over the last 3 years. 99.8% of the time bills were submitted to the community. They were funded by the community. And this is everything from little, $69 pediatric checkups to hundreds of thousands of dollars worth of cancer cases, brain hemorrhages, NICU babies, automobile accidents, brain surgeries, open heart surgeries, all kinds of stuff. And so this has been shown to work for the small cases and the big cases. And, our members have loved it. I mean, that's the coolest thing is people come back and like, wow, like I never I could love my healthcare company so much. Coming off of Aetna, who feels like they are my enemy, the first thing you do when you have a big health event, you're like, oh, I have to go fight with my health insurance now to go pay for it. He's like, you're actually my advocate. You're fighting on my behalf against the system as opposed to being a part of the system who's fighting against me. It totally changes that dynamic. And that's why I think we're being so successful.
Yeah, that's a huge thing. So as a person, so if I write someone a check for $100 this time, how do I not be the one who's writing checks for everyone every month? Is that do they have how does it work? Do they have a set fee? You go, okay, to be a member of this, you're gonna have X number of dollars a month, and then above and beyond, does that go towards some kind of credit for you when you get into a car accident or something happens, right?
Sure. Yeah, no, it's so we'll charge you twice a month. One is $50 per person on the plan or on the membership. That goes directly to CrowdHealth. That pays my fees. We are totally aligned with you. If we keep expenses low, more people will sign up. We'll make more money. We make money when you're healthy and you have a great experience. Like this, incentives are perfectly aligned. So that's $50 per person per month comes to us. And then we'll ask you once per month up to $135 if you're a single person to help somebody else out in the community. So we will only ask you, once. If you say no or your payment failed or whatever, we'll ask you a second time just to give you a second chance. But we'll ask you once per month to help, Brian with his broken arm. And if you say yes, then your ACH or credit card or whatever payment method you're using is going to deposit $100 or whatever that amount was into Brian's account, so that at the end of the day, Brian has the $5,000 in his account. So the question is I've never met Brian, so why would I give Brian, money? Well, when Brian asks for the broken arm funds, we know two things about him. One is the last 10 times that Brian asked, did he say yes, 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 yes to other people, or did he say no, 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 no to other people? And so, as you can probably imagine, the people who are giving to others are the ones that are also receiving from others. Because if you've said no, 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 I'm going to look at you and be like, wait, hold on a second, dude. Like you want the community to fund you, but you weren't willing to fund the community. Like that doesn't work. And so those bills don't typically get paid. The bills that do get paid are the ones from people who have been generous and have said yes, 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 yes. So that's one thing. We also know that, did Brian go to the Mayo Clinic or did he go to the local hospital for his broken arm? Because there's no need to go to the Mayo Clinic for a broken arm or a flu or something. And in essence, what we're asking is did you do some shopping to get a good price for your broken arm? Now, we don't expect you to have to do that. If you will allow us to shop for you and find you a great orthopedic surgeon or whatever in San Diego, then we will do that for you. Or if you want to go find them one yourself, that's fine. But we also know what the fair price is for whatever, a shoulder or a knee replacement or whatever in San Diego. So we know that if did you pay a fair price for that, and every time you allow us to go find you, it's a fair price. If you want to go out and find it yourself, then go for it, but it may not be a fair price. So call us and let us find you a really great orthopedic surgeon. So that's how it works. And like I said, 20,000 times so far, and it's worked really, really well.
And how about exclusion criteria for coming in? I know a lot of the Christian ones will say, look, if you want a sex change operation, we're not paying for that. There's certain things we're not going to pay for breast implants necessarily, unless you maybe had breast cancer, something outside of your. So, for instance, if you get a drunk driving, does that, if they put themselves in a dangerous situation purposely, does that mitigate some of the responsibility?
We have very specific exclusions. I think the last thing we want is like, oh, well, you're gonna, not let me fund this for all kinds of crazy reasons. I was like, we don't do any of the breast implants. We don't do sex changes. We don't do abortions. We don't do those types of things. Says nothing about kind of the morality of those things. You do what you need to do. Like, this is more just like, hey, listen, we don't want to have to submit these to the community because it's going to alienate 50% of them. So just FYI. So none of those things. If you are under the influence of drugs or alcohol and you do something stupid, those are not eligible. So
you're limiting your risk, and then you can make it cheaper for everyone. Because when you're covering all this stuff, my brother and his wife, he's like, look what I have to pay for my insurance. I have to pay for, drug and alcohol abuse counseling. He goes, I'm never going to need that. So why am I paying for all this stuff that I'm never going to be a part of?
Yeah, you're getting into a community of people who live healthy lifestyles. If you are a smoker, there are really only exclusions that you can't join is if you're a smoker or if you're obese. So, those two, we have two exclusions on that. And so, otherwise you can come in and join us. And our BMI of our community is about 5 points lower than the national average. So it's a group of healthy people. The average age, I think, is 32 or 33. I haven't looked at it in a while, but it used to be 32 or 33. So you've got a number one thing that we fund are babies, which, man, I don't know about you. I'm all about funding babies. I have no problem with that. Number two is active injuries. So these are people out doing active things and just things happen. We had a member, tear her ACL playing pickleball. It's going to happen. We have members do mountain biking accidents all the time. It happens. And so it's like, I want to be able to fund things where people are out living life, enjoying themselves. And if something happens, like, great, like let the community come and help you for that. So 75 to 80% are in those two categories. About 10% is in wellness. So it's your annual checkups and things like that. And 10% on illnesses. So, the vast majority of your funds are going to things that, you and I would have no problem, helping out with. Like, that's the beauty of our system.
Yeah, things happen, and you don't want to get stuck with these huge bills, and having the community help out, and people love that community, and building a sense of community too. It's like,
yeah,
I know I'm going to help someone directly. Like, if I'm going to fund helping people in North Carolina, I'm paying doctors who I know are going to help the system, and not guys who are you work for FEMA or something. Like, I don't know where the money's going. It could be going anywhere, like these big, huge charities, and you go, oh, yeah, I'd rather go to my local guy.
Yeah,
I'm there working.
Look, we do not get in the middle of that money flow. So that goes from Brian. If I broke my arm, it goes from Brian to Andy, and CrowdHealth doesn't get in the middle of that money flow. So we've got the back end system set up so you are helping somebody directly. We have some really cool stories. We have Abby, who's 19 in Tennessee. She lost her fingers in a boating accident last summer. And, we go around and crowdfund this from people, and you are actually helping a 19-year-old who lost her fingers. And we actually had people come back to us and say, hey, like, man, I feel awful for her. Like, can I do more? Like, can I help? Instead of $100, can I give $200? And you're like, what? Like, you would never call United Healthcare and be like, can I give you more money this month as opposed to last? And so I actually feel good that I got to help Abby with her, her fingers, as opposed to sending that money, my hard-earned money, to United Healthcare, not knowing what the hell they're going to use that for. So your money, literally directly goes from your account to their account. And that's the beauty of this.
And probably, I would think that most people on the planet, like if I go and get labs for my annual, like I would just say, okay, $100. Like if we do, for me, with my patients, I do cash pay. I use a cash pay lab, and it costs like $130. They're like, you know what? Pay it. I'm not dealing. They wouldn't go through the hassle of submitting it to you. They would just pay it. Like it's not.
Most do.
Yeah.
We allow people to submit. It's typically what it is you own the first $500 of any health event before you can submit it to the community.
Mm-hmm.
However, for wellness exams, so we call a wellness either a set of labs, a primary care or direct primary care, pediatric, gynecology, vision, or dental. You can submit one of those six once a year, and those are fully fundable. So doesn't have the $500 kind of pre payment commitment. So we get people who do that. And the other cool two things that we do is, as well as we make like DEXA scans, VO2 max, coronary artery calcium scores, also fully fundable during like a quarter every year. So we have like a DEXA scan in the first quarter, and we have a VO2 max in the second quarter, and a fasting insulin in the third quarter, and a CAC score in the fourth quarter, and things like that too. So we're trying to educate people on what is really important, in their health, as opposed to just going to the primary care doc and being, spending 7 minutes with them and being like, oh, yep, you're good, go ahead. And so, we think it's important to start educating people too on what's really important.
Yeah, and how does this work with the Affordable Care Act? The fine if you don't have insurance, does this qualify for that? Is that state by state, or how's that work?
Yeah, so I talked to a guy in California, because there's the Affordable Care Act had a requirement for everybody to have health insurance. The Trump administration got rid of that penalty, so there's no federal penalty to not have health insurance through the Affordable Care Act. There are 5 states that have a state level requirement for you to have health insurance. And let me see if I can pull them off. It's California, New Jersey, Massachusetts, Rhode Island, Vermont, maybe Maryland. So, we have 5 states that require you to have health insurance, or you get paid a fine. I mean, I talked to a guy the other day. He was paying $2,000 a month for his health insurance. He joined CrowdHealth. He's now paying $600. He's saying $1,400 a month. So it's almost $20,000 a year, not even looking at deductibles. And he had to pay a $2,000 fine at tax time for not having health insurance. He's like, look, dude, I just saved $20,000 plus on my healthcare. I'm totally fine paying the $2,000. Like, that's not a big deal for me. So
it's a no-brainer. It's a no-brainer.
It's a no-brainer. Yeah, it's a no-brainer.
And that's why I was thinking. As a matter of fact, I'll just tell you, so, full transparency, the health insurance that I use, which is a Christian-based crowdfunding source, right?
Healthcare.
Like Christian Healthcare Minister, CHM. There's Medishare. So I reached out to him. I go, look, years ago, and I go, look, in 2020, when I was first starting my practice, I go, look, if you find doctors like me who are doing direct primary care, it's a perfect marriage. It's a perfect marriage for what we're doing, because and I would say the same to you. I'm in Arizona practicing now, right? In California, but mostly Arizona. So in Arizona, you go, okay, look, they pay you $50 a month per person. They pay me $100 a month per person. That's $150 for Cadillac coverage. You call the doctor and he gets back to you right away. I have no incentives. You're not giving me a kickback if I prescribe a certain drug or I do certain unnecessary testing. And you go, wait a minute, that's the best possible deal. If you're a small business owner, it's a no-brainer to cover your people. If it got so it costs $50 plus whatever. Like if you're gonna pitch in for other stuff, so say it's $250 a month per person, right, and $100 to the doctor, because we're not making money on the system. That the primary care has never been a drain on the healthcare system. It's all the testing and the chemotherapy and the major car accidents and things like that. And diabetes complications. It's a huge draw off the system. So if you're saying, look, we want to keep our people as healthy as possible, and I say, look, I want to keep my patients as healthy as possible, there's no better system, no better team for your health.
Agreed. Yeah, totally agree. And we allow members to fund up to $300 of that DPC. So if you're charging $100 a month, their first 3 months, they get funded by the community, and so they're only paying 3/4 of that, and I think that's fine. I mean, that people need to have a little skin in the game, and you're getting way better care than if you were to go to see a fee for service primary care doc. So I agree with you. It's a wonderful marriage, and we are all about direct primary care.
And for
Yeah,
you,
love
it's a
what you guys
deal.
are doing.
And for you, it's a deal because they're investing in health. And when you see it from that standpoint, you go, look, if my patient is going to, and also if the doctors are charging $300 for an office visit, right? Like you guys are have to pay more out of your pocket for, or
The crowd.
the crowd has to pay more for that, right? So if you go, look, let
Hmm.
me find direct primary care or cash pay doctors, there's cash pay urgent cares that do it things cheap. They go, you want sutures? We'll do it for this much.
Yeah.
Yeah, so it's probably even on the border towns. I have people all the time. They go, yeah, I just go down there to the dentist and I get all my teeth fixed. It costs me like $300 down there. It will be $4,000 here. It's ridiculous when you hear that and you go, man, I'll pay for that. I'd rather pay that than
Yeah.
four
Yeah.
thousand
No
dollars.
joke. No joke. No joke. Yeah. Arizona is a great state for us to operate within. So we love you, Arizonians.
Oh, very good, Arizonians. It's a great state for me here because I'm here too, and I can take care of anyone in Arizona. But that's what we do is we find cash pay. Like, oh, look, imaging centers, you're going to charge this much. I'll send all my patients. If you have 300 patients, they're all going to go to the same imaging center. I have 2 meetings coming up in the next couple of weeks. Say, look, give my patients. I don't get any kickbacks on that, but I say give my patients the best deal because then I'll go. Here's the advantage to
Yeah.
you.
Yeah, for
I
sure.
could draw
Yeah, I
labs
love
right in
that.
my office and you save the draw fee. All these dumb things you don't even think about that they charge you, $20 to put a needle in your arm, at some of the big labs. So we'll drive right here. My medical assistant can do it. No biggie. Right. And you don't have to
Yeah.
drive somewhere and wait in line for 2 hours. I mean, it has to do with the convenience too, but to have that level of care, is there any point where you go, what do you do? Like, are there some people that would be better off having a backup ACA plan or something like that and using this for basically their primary care?
Yeah. I mean, if you have a chronic condition, you know, it's probably better to go, with an ACA plan, assuming you have the dollars to spend on the deductible. With that said, we've got, a bunch of type 1 diabetics who actually are part of CrowdHealth. And what they've found is that they can save enough money with, the lower monthly fees that they can, pay for their insulin and pay for their supplies and all those kinds of things. Because, if you join CrowdHealth and you have a pre-existing condition, you got to own that for a couple years before you can, the community will help you out with it. It's just not. I don't think it's fair for me to need a knee replacement. Me jump into CrowdHealth, get a knee replacement, and then jump out. Like that just doesn't. There's too much
Yeah,
moral
totally.
hazard
Absolutely
there,
right. Yeah, yeah, totally. And
and
that's
so these type 1 diabetics understand that, know that, but are saving so much money that they're like, you know what, I'm just gonna, and we can find them insulin that is way less expensive than if they pay for it through their insurance. And so that's the other thing. Medications, imaging, labs, like all of these things are significantly cheaper if you pay for it through cash pay. We had a woman who had non-Hodgkin's lymphoma, and her medication was going to be $40,000 a month. And so we approached the pharma, and they dropped it to $2,500 a month because she's paying in cash. 40,000 to 2,500 because she's paying in cash.
it's like you're gonna go buy a car. Okay, it's 80,000. Okay, we'll give it to you for 5,000. Like it
it's
doesn't. It makes
like,
zero sense at
what?
all, and it's
It makes no
insane.
sense. Like there's all these inefficiencies in the market that we are able to, for the most part, strip out because people pay in cash. Like that. This is the way. This is the way.
So if people are obese or smokers, they're excluded off the top. Now here's the question: what happens if they're on a plan and they're coming down, they're like doing their low carb keto, their carnivore stuff like that? So are they excluded, or do they have 2 years to get their act together? Because that would be
Well,
a huge
maybe I
incentive for
should do
people,
the
right?
2 years or the year or whatever to get their act together. I think that we've had members who were, we had one guy who was 60 or 80 pounds overweight. He lost, the 60 or 80 pounds. I don't remember exactly. And then he sent me a year after he joined, he sent me a picture of him and his wife doing a triathlon. And his caption to the picture was, "You guys inspired me to make the decisions I needed to make to improve my lifestyle to lose weight, and now I'm a proud CrowdHealth member." And every tweet that we put out, the guy comments like he's our biggest supporter ever because we inspired him to go and do some change. I mean, I think there's a big question here, and I know that you're passionate about this too. You wouldn't need crowd health if people live better lifestyles. We are 75% of our folks are overweight. The majority of them are obese, and so the medical cost associated with obesity. I mean, you talked about diabetes earlier. I mean, that's one of the main causes, right? Is just the lifestyle, prolonged lifestyle issues. These things can be changed. Like these things can be cured. And if people would change their lifestyle habits and stop eating crap, we would not have to have crowd health. Our healthcare system probably would heal itself. But we have such an overwhelming amount of people who live unhealthy lifestyles and American diet that our health system is getting cranked, unfortunately.
Yeah, as a matter of fact, I was talking to a guy who's an insurance broker, and he said, you know what, the worst thing you could do is check like fasting insulin A1C for B. If you say pre-diabetes or diabetes, you're going to get excluded from healthcare, or your cost is going to be way higher because they know that's what costs the money. So it's a hard thing. So the nice thing about direct primary care is I can order a whole battery of labs, and you're paying cash. You don't need diagnosis codes for that, right? I don't have to put diabetes. I don't have to put high cholesterol, heart disease, whatever on the labs itself. So when you have to put it, like if I'm in insurance, and this is what I tell people, I go, look, if you want a fasting insulin A1C, the only way the insurance company is going to pay for it is if I put pre-diabetes or diabetes, and that's going to hurt you down the road when you go to get life insurance. That's going to be a diagnosis code that you have on there,
Yeah,
right? So if you're
yeah,
paying cash
yeah.
for it, you don't have to put any diagnosis code. It's just you pay cash and no one cares. It's just what it is. So things like that you don't think about. And the other bad thing about going to standard care is like if you're in a senior HMO plan, if I say, yeah, you're alcoholic, like you say, I drink so much, that's alcoholic, that meets the criteria. I get paid more for calling you an alcoholic. But then when you go to get life insurance, guess what? You're an alcoholic. They don't want to insure you. So all these things that people don't realize down the road that's going to hurt you, it helps you now maybe. So I tell people you might be better just going to the cash pay lab and getting these two labs. You can go through the rest with your insurance, but do not get those through your insurance because that's gonna haunt you. Trust me on that. So for instance, a PSA, I had a patient and the lab was at my old office, in 2019. We order a PSA on a guy who's 74. He still wants a PSA, and Medicare denies it. And they go to the patient and go, you owe us like $85 for that test. Medicare is paying them like $6 for that test, but they charge the patient $80,
Jeez.
right? And you go, oh my gosh. So I actually just had a meeting with one of the big lab companies. I go, what do I do when that happens to my patient? She goes, order those tests through cash pay and order the rest and they're like, well, but that's a hassle for the patient. But they'll draw them at the same time at least. So that's nice. But they just
Yeah.
submit it different bills. And that one goes to cash pay and the patient pays it right there. The other one goes to Medicare. Yeah, it's
Is that what
wild.
you found is fasting insulin? Fasting insulin, health plans won't reimburse for a fasting insulin test unless you're pre-diabetic or diabetic.
Absolutely. Yeah. You can't just order like A1C if you don't have high sugars, they're not paying for it. So your
Jeez.
patient is getting hammered because they come to you and go, look,
Yes,
doctor.
it's
I'm
the
like,
canary in the coal mine. Like, from my perspective, the fasting insulin is the canary in the coal mine. Like it'll tell you a lot about what's going on with your metabolic health. And I mean, I'm 180 pounds, 6'2". Like, and I used to get my fasting insulin because I want to know like how am I doing metabolically? And so fasting insulin and visceral fat for me are the two things that I really pay close attention to. Um,
and it may
and
be that may be something you switch in your program, not go by BMI. It may be go if you can prove your BMI is high, but you have good visceral fat, your insulin's normal, your triglycerides are normal, your HDL is normal, your metabolic. I have people who are 300 pounds, women who are 300 pounds, and they're metabolically healthy. They just store all
yeah,
their subcutaneous right now. But once they go through menopause, it's all going to go visceral, and they're going to be a train wreck. But if we can
yeah,
intervene now and prevent that, then we can save the system a ton of
so
money.
good, man, so good.
Yeah,
Yeah,
so there's so many
love
things
what you're
like that
doing.
you look at, and you have I see you have even separate risk pools for carnivores, like people are carnivore or
Yeah,
keto, and like so. Explain that a little bit.
yeah. Well, we've got a community that we're building of carnivores or keto. It's low carb, and we call it the carnivore crowd. And so, in essence, what we're doing is building a group of people who are going to fund each other's healthcare expenses that are on low carb diets. So we are, you are only allowed in that community if you are in the kind of bottom 25% of visceral fat levels. As the best way cheapest way of doing it. It's not perfect, but best way to do it is through a DEXA scan. Um, and then, if you have insulin levels, I think it's below, can't remember if it was 5 or 6. I can't remember, but about 5.5, I think 5.5 visual or fasting insulin levels below 5.5. So if you have one of the two of those, then you can join the carnivore crowd. And it's just a community of people who are dedicated to low carb eating, and with the thought there that they are, although the medical industrial complex will tell you differently, are much healthier than the general population, will have lower cost, and therefore you will have to pay less per month than the general population. So it's going great. We've got a lot of people who've signed up, and we're excited about our carnivore crowd.
Yeah, it's pretty cool because the thing that I get a lot of patients are like, look, I'm coming to you because my doctor every month is yelling at me, say I need a stat, I need all this stuff. I need,
Yeah,
and it's so hard because they go, look, their BMI is like perfect, and they have all muscle, and they work out 2 hours a day, and you go, okay, they might hurt their back or their knees, and we have cash pay chiropractors, we have cash pay people who can resolve that
yeah.
problem a lot faster, and it's better than just throwing opiates at it and pain medicines and anti-inflammatories all the time, right? I mean, I was thinking while we're talking, I went to when I had dark hair, I wasn't gray hair yet. I was just a kid coming out of training, and I'm at this conference, and this old guy stands up and he goes, 90% of what you will treat is lifestyle mediated. 90%. And I was like, this guy's a nut. And then I started looking and I go, man, he underestimated, right? Even a pulled muscle hurting your back. Like you said, if you're in an active community, you're out mountain biking, chances are you can fall. Pickleball, you can blow your knee out. Those kind of things happen. But all the chronic diseases, all the money is going to, you're way less likely to get those things if you're out healthy and active and doing stuff. So,
Yeah.
like you, I'd rather pay for a broken arm than for dialysis for the next 20 years.
And our doctors are not being trained on lifestyle medicine.
So, are you selecting doctors like me out there and going, okay, if you're in Arizona, go see this guy?
That's I mean, we have our favorite doctors in each one of these areas for sure. So.
Yeah, we don't have
any direct relationships with doctors, but we have members who go to these doctors. We ask them a bunch of questions about, what the doctor, how the doctor treated them and things. And so we have got a list for most parts of the country of our favorite doctors, whether it be a primary care, direct primary care, orthopedic surgeon, OBGYN, pediatrician, things like that. Many of our members don't want to go to a pediatrician and get, vaccines like right away. They want to wait on that, which is, totally fine. That's up to them. And so we found some pediatricians who, won't push vaccines on people. We found, docs who won't, if you have, high LDL cholesterol, won't push statins on you or shame you into taking statins. This is big for our carnivore crowd because many of us, have a little bit higher on the LDL, myself included, and I don't want to take statins, and I don't want to be shamed into taking statins. So we find you docs like that as well. So what in essence what we're doing is we're trying to help you find really great docs, and then help you pay for those docs. I mean, that's really what CrowdHealth is trying to do, and we do a pretty good job of it.
And that's awesome. And I would love to plug in with you too and go, okay, in Arizona, here's the guys who will take cash for a knee injection or whatever, those kind of things. Because if the primary has it, that's super valuable to our patients. That's more valuable than anything, really.
Yeah.
And so to have people that are like mine to go, look, I just don't want to be chased with a needle every time I go in. Like I was just reading something with pediatricians, like 47% of their income is from vaccinations. And I go, of course they're going to push it. That's half your income. If I'm going to lose half my income. The only thing that sucks about this is you don't give me any kickbacks if I throw all kinds of drugs on people, man. How am I supposed to make money?
I think you should be able to do whatever you want to do with your own money and your own body, and you decide. I don't think the insurance plan should be deciding what we should or should not do, or incentivize others to be telling us what we should or should not do. I mean, that's personal responsibility, and that's what I'm all about. So
yeah, that's what I love too.
That's what CrowdHealth. That's what CrowdHealth pushes. We're not for everybody. If you think Medicare for all is a really good idea and the government should own your healthcare, we're not for you. Like, you're not going to like us. If you are one that like, I want to take personal responsibility over my own healthcare, then we're a great fit. So, you asked the question before, like, is there people who aren't a great fit? Like, if you think that, a company in healthcare is there to take care of you, no, that's not us. You're there to take care of yourself. We are there to help you do that, but you need to take personal responsibility over your own healthcare.
Yeah, that's a huge deal. And then also don't you think it's a perfect fit for small businesses? Like you have 12 employees and you go, okay, if I'm going to spend, is it like literally like if I have, like what would, as a business owner, I have 6 employees and I want to cover all my people, right? Like what is that out of pocket for me?
Yeah, I mean, six employees if they're single employees, I mean, let's just start there. If they're single, it's probably, $1,500 a month or something like that for 6 employees.
Yeah, that's a
I mean,
huge
it's
like if you're not
it's next to
providing anything
nothing
now, that's nothing. Like you write that off. It's not a big deal, right? And then, then the employees are so if they every time they get injured is a 500 per claim, right? That they're
per
covering
injury. Yeah,
themselves.
yeah. So there's
But
no
most of
like
us can
five or
cover
ten
that.
thousand dollar deductible.
Yeah, and
Yeah,
if I
everybody can come up with $500. Like you can figure out how to come up with $500.
well,
you know,
I know companies, and because they're going, look, I'm switching from 1,400 a month per employee to something where it's say $100 a month per employee. So you're saving $1,300 a month. So I'll give you a 5,000 or a $500 credit card. You hurt yourself, here's your 500. You go pay that with a health savings account, right? Most of the people are not never going to use it, especially if they have a direct primary care doctor. They're never going to use that $500. So maybe they can use that towards the primary care and they pay for 5 months of their direct primary care, right? So there's so many things that you can do where it's not coming out of the employee's pocket and they're covered. So the worst thing possible, business owners, if you have an employer or my patients, like if I have patients come in, they say I have no insurance, and I'm like, get some coverage. You get hit by a truck, you don't want to lose your house and your family because of the
yeah,
day, right? You got to have coverage. I'll take care of the little stuff. Like no one gets a copay from me. No one gets. They do. We cover their annual exam. So for you guys having a direct primary care is like they're not paying anything for their annual exam. They've already paid for that. You see what I'm saying? So no one's going to submit a bill to you for $100 for their annual because that's what they paid for that whole month anyways. And if they come to me 10 times or one time, my bet is as a primary care, if I get you healthy, you're not going to have to see me 50 times a year. You're going to see me once
right.
for your annual, and a couple of times you're going to call and go, hey, let's just review the latest study and talk about things like that and talk about the grandkids.
Sure.
But
Yeah,
so
yeah, sure.
and so probably once people get on Medicare, they just go on Medicare. They don't use your services anymore, right?
Yeah, we stop at 65, although that might change over the next, couple quarters. So keep an
Yeah,
eye
kind of
out.
seeing. Yeah, yeah. So as you're younger, like if you're young and healthy, like really, my advice would be do something. Don't go without insurance and go. If it costs you $100 a month, okay, that's worth it. Like how much do you pay for your gym membership? How much do you pay for, uh, you know, Starbucks? Right? Do the
Yeah.
math, and you'll go, okay, I got to have coverage. And no one wants to get this $10,000 deductible. And that's the problem is if you're not going to a direct primary care and you're just going to a standard doctor, you're going to pay way more if you get sick a couple of times than you would just paying someone $100 a month for the year, $1,200, and you're covered, right? You do
Yeah.
this. So say it costs you, you look at it, it's like that's less than you pay 1 month for your big insurance. This is what's hard to get past people's brain because they go, look, I have insurance, I'm going to use it. Yeah, but your insurance, you're paying a huge copay every time you go in, right? It's costing you more
Mm.
money to get sick. And so there's an incentive for you not to get your colonoscopy. There's incentive for these things. And that's why I'm actually surprised why these insurance companies don't like direct primary care and some of these big ones. And like, seriously, 60% of my patients are members of these big HMOs, but I go in there, no one knows who I am. I sit there for an hour. They have 10 minutes with me, if that, and they go,
Right.
how are they going to help me with my lifestyle? Like I can sit for an hour and go, okay, how much do you extra? Okay, let's go up on this. Let's change this. Let's tweak this. Can we get rid of those 18 tortillas? Can we go
Yeah,
down to
yeah, yeah.
4 tortillas, right? Or whatever. I mean, that's the thing is when you
Exactly.
sit and talk to people, go, oh, you're really stressed. And maybe we could work on that stress. If I get your stress better, guess what? All the other stuff gets better, right?
Yeah, yeah.
It's an investment. Like who wants to be a part of the sick all the time and going to when you talk to older people, the joke is my social engagement is going to the doctors and they're like seeing different doctors for everything all week long. That's their social outings.
Yikes.
Yeah, it's so preventable. So anything else you want to let people know? Like how do they track you down if they go, okay, let me look into this and see if I'm a good fit.
Yeah, joincrowdhealth.com is our website. And join Crowd Health on all of our social media platforms is where you'll find us. So yeah, come check us out. Give us a shot. We'd love the opportunity to serve you well.
And you have people there that will call that like I get appendicitis, I have to go to the hospital. And they'll call and say, hey, look, one of our patients is there, and is that how it works, or the patient negotiates with the hospital for something like that?
No, it's usually if you're going to the ER, you're getting the bills afterwards. So they'll start sending you the bills between 3 and 4 weeks after you get out. And so what you do is you gather all those bills, you go to our app, and you actually literally just take a picture of the bill. We consolidate them on the back end on our side, and then we have actually attorneys who will call the hospital on your behalf to negotiate them. So let's just say your appendicitis or your appendectomy was $30,000 or something like that. We would reduce that. We'd probably get it down to say $8,000 to $10,000. We call you and say, hey, we got it down to 8 to 10. Can we crowdfund that for you? You say, yep. Then we send that to crowdfunding. That typically takes 3 or 4 days. And then you have the $10,000 in your bank account now to go and pay for that hospital bill directly. And so that's how that would work. So it's super easy. You don't have to do anything in the hospital. They treat you the same way as they would somebody with health insurance. They're actually legally obligated to do that. And so, it's a wonderful thing where you don't have to worry about like, oh my gosh, do I have to pay my $10,000 deductible? Like, how am I going to come up with that? You got to come up with $500 and send the rest to the community. So it's a much easier way of doing this.
And do you have backup finances in case the community doesn't come through, or is it every time the community has come through so far?
Every time, 99.8% of the time, the community has come through. And for the 0.2% that it didn't come through, it's because people didn't come. Those people who submitted those bills didn't come through for others. So
awesome, man.
That was the reason.
Yeah. These are all biblical principles here, right? You give and you
love your neighbor.
Love your neighbor, do the right thing, minimize, like, I don't want to cost people money. I'm not going to do dumb stuff. And so I think it's pretty awesome, man. I'd love to talk to you offline and see how we could all work together. And,
we'd love that. Let's do it.
And so everyone, be kind to yourself, be kind to others. Andy, I didn't ask you. I have to ask you, since this is Life's Best Medicine podcast, what's life's best medicine for you? For Andy Schooner, what is life? Where do you go when things are hard? Where do you draw your strength from? What keeps you moving forward? All that kind of fun stuff.
Man, I got to say, faith is number one. Family is number two. So I've got a very strong faith in a sovereign God, and I have an incredible wife who puts up with my garbage. And between those two, I live a pretty awesome life.
Yeah, that's awesome, man. I'm in the same boat, man. You live your life the right way, and again, you're going to be less of a resource. You're going to be helping other people and, contributing to help other people and doing things. That's what life's about. Ultimately, is like, what kind of impact do we leave? So yeah, I'm happy what you're doing. And the reason I'm talking to you right now, I had 2 patients say, oh my gosh, here's what I'm using. I love these guys. I'm like, I gotta reach out to Andy. I've been like kind of flaky on that. So yeah, so I'm glad that we finally connected, and keep up the great work. And if you're not in one of these 5 states and you say, look, I think I want to do a better thing and I want to get healthier, like that's what we're both of us have the common threads. Like, let's get you healthier, and everyone does better in the long run. The healthier the population is, the better we do. You don't want to be part of sick care. Trust me on that. You could write that down, and we'll talk later. So everyone, thanks for listening. Thanks for the support. Amen. Thanks for joining me, Andy. Go save lives, man.
Thanks, brother.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.